Well, hello, ABC 15 Facebook fans. I'm Terry Olette. I am so glad that you have chosen to listen to this live Facebook broadcast this morning because the information we're about to give you could possibly change or save a life. If you or someone you know is struggling with addiction, we want you to know that you are not alone. September is National Recovery Month, and we have a team of people who are ready and willing to help you get the treatment you need, help you find the treatment you need, and possibly help you talk to those important people around you who might need the treatment to help them get there. I want to introduce you to our team we have here this morning. This is from Pinnacle Peak Recovery Center. We have the medical director, Dr. Stephen Lochnikar, joining us this morning, and also Kaylee Taya. She is the executive director. Thank you, both of you, for joining us. We have lots of important information to get out. Oh, and I want to tell our viewers who are watching right now, if you have a question for Dr. Lochnikar or for Kaylee, please go ahead and pop it up there, and we're going to try and get those questions answered for you. First of all, I want to start with you, Dr. Lochnikar. We have seen a lot of changes in our lives over the last couple of years. Have you seen, as the medical director of a treatment facility, a tremendous uptick in addiction?
Absolutely. These past 2 years have been the busiest, sadly, the busiest that we have ever seen in the last 15 years. And I think it's a combination of, obviously, from COVID pandemic. People are staying home, they're isolating, they're tending to drink when they're at home and you're not socialized too much. And then the fentanyl epidemic came into Arizona a couple years ago, and that is in full swing right now. And the combination of those two events have really created a perfect storm for addiction.
Absolutely, and we unfortunately we're hearing about it all the time in the news. I want to talk about the importance of recognizing signs and symptoms of someone who is struggling. Dr. Lochnikar, what would be some telltale signs that we know somebody's crying out for help?
So, and that's a real tricky question, and most families encounter that question in their minds before they approach a family member. The most basic, the things that you notice first as a family are behavioral changes in a spouse or sibling or a child. And those behavioral changes can be very subtle, and it could be anything from agitation to anger to tardiness or any type of change in behavior that a family member is used to seeing. So, once your antennae are up and you notice a change in someone's behavior, our recommendation is to approach them and talk to them and find out what is going on in their life.
Okay, and that's where I turn to you now, Kaylee, because those are some words that can be hard to find. Whether it's someone that we know or maybe even to ourselves, what are some of those? Give us some words, Kaylee. Help us make that first step in saying, hey, what can I do to help you? What should we be saying?
So you kind of hit it right on the head. It is so important that we're approaching our family members, ourselves, our friends with a very non-judgmental, understanding approach. So often we hear, I don't understand why they're doing this. I can't figure out why they won't stop. They have so much to live for. And the answer is right in the question, is that you don't know. And it's important to remember that it is a disease. It's a disease of the brain and the body. And there's enough shame and enough guilt within the addict already that someone suffering from substance use disorder really needs the friendly, loving, understanding approach where they can have that space to be truly open.
Yeah, and unfortunately, especially for family members, that's not our first reaction. It can be anger, it can be embarrassment, and it could be so many things, and that's all okay. And I'm guessing, Kaylee, very normal.
Absolutely, it's definitely becomes kind of the first go-to, which then tends to push our loved ones further away. Because chances are the person suffering doesn't know either. They don't understand why they can't stop. They don't understand why they're making some of the decisions that they're making, and without the proper treatment, and it can just continue. The cycle can just continue to go on. So when being combative and blaming and shaming, it can actually push them further away.
Action.
Sorry, did I lose you guys?
I can see you now.
I can hear and see you, Doc.
Yeah, I can see you. I can't. Terry's frozen.
She's frozen for me as well.
Yeah. But you're absolutely, I don't know if they could still hear us, but you're absolutely correct. I mean, it's so insidious for the patients. They really don't see their change in behavior until somebody else first recognizes it. They think they're doing well. They think they're leading a normal life, and no one notices. But it is obvious to everybody else around them first.
Absolutely. They often think that they're hiding things more than they may be, that they're, trying to get a grip of what is going on in their own life, so that they're, masking, and the lies and the manipulation comes out, to where if they're not ready to recognize that there is an issue, if not approached in an understanding and supportive way, then the manipulation and the anger can just be heightened.
Yeah. And I think that's the key. I mean, once you approach them and you're able to talk to them, and they come, they become honest, then, you're already in the first step of recovery. Once they admit that they're doing things and have a problem, then you're on the road to recovery from that point forward.
Absolutely. I find it very important too for the family members to gain a little bit of an understanding, as much as they can, without suffering from the disease, as to what it can look like and what it can entail, and what treatment can actually do for somebody. There's so often that the person suffering has an idea of what a alcoholic or a drug addict looks like. And it's so easy to compare yourself out of the problem, to where you look and I'm not that. I have a job, I have a family, I have all these things that it can help to ignore and stay in the delusions of what's really going on.
And then, what we talked about, then the next step, once they, acknowledge they have a problem, then their very next step would be to call Pinnacle Peak Recovery, for example. And who would they get a hold of there? They would get a hold of you or the admission person at Pinnacle Peak?
Great question. So the first person they would get a hold of is our admissions coordinators. And they're really there to listen and give that understanding, and kind of explain to them what the next steps would be. We would find out what this person is suffering from, a little bit more information, to ensure that we are the appropriate treatment facility for them, and that we could meet all of their needs. And then they would get a better understanding of what the next steps would be. Yeah. As you know, Doc, you are one of the first people that they would see once they come in, to ensure that we're medically and stable and safe when beginning the treatment. And they would be greeted by the rest of the intake staff, and meet with their primary therapist. And so those would be kind of some of the first steps that they would encounter.
And then, certainly if they would need a detox from any substance, from opiates, fentanyl, alcohol, meth, whatever the substance may be, they need to understand that safety is our primary concern, that once they enter our program, they will be monitored by a staff of physicians, myself being the medical director, and 24-hour nursing care. and we will detox them in a safe, number one, and a comfortable environment. And they will go through a detox process and segue after that, if necessary, into a residential program. And you can even talk about other programs that we have after an intense residential program.
Yeah.
Well, you guys are fantastic. I'm back, and I've been listening to everything you've been saying, so thank you for that information. And I know you were just talking about where, the process of when you get a chance to make that decision for recovery. A lot of people, and I'm just wondering this, Kaylee, a lot of people have to work. They need to work. Is there a way to enter a recovery program and still take care of your family?
Yes, absolutely. Now, there are multiple levels of care, and it's, there's going to come with assessments to make sure that you're being treated at the appropriate level of care for what somebody would need. But we do have options, and there are plenty of options out there for what would be called intensive outpatient. Now, this could be something that's done 3 hours a day, for 3 days a week, for 5 days a week. There's different variations of outpatient services where we can really try to meet people where they're at and make accommodations for, their jobs. If someone hasn't lost their job, we don't want to make things worse. We're trying to meet people where they are and really give them the tools and resources to pick their lives up right there.
Yeah.
I'm just interested, Dr. Lochnikar, what are the demographics? Who's coming in now with problems? Are you surprised by, is it more men than women? Are they older? Are they younger? What's happening right now?
Yeah, that's a great question. And the demographics, they do seem to change throughout different times. Or they evolve throughout different years. But as of right now, I think, unfortunately, we are seeing a much younger demographic with extremely young teenagers, early 20s, people that are getting dependent and addicted to that street drug fentanyl, which goes by the name of a street blue. And they're the fake oxycodone that are out in the street. That seems to be the primary demographic right now. However, every age bracket, every gender and race is affected by this disease.
Yeah.
Just to
and we just can't not talk about it enough. Go ahead, Kaylee.
Yeah, I just, to piggyback a little bit off of what Doc was saying, is we are seeing a huge epidemic of this fentanyl and things right now, which also helps to lead to sometimes people not quite thinking, because I'm not using that drug or I'm not using this drug, that I don't need help. And we are still here to help for any substance that we may be using or abusing. And, like we were talking about earlier with this COVID pandemic, the alcohol has been very strong. And we're seeing a lot of people who are using that as a way to cope with this stressful time and minimizing their use because, well, I'm not using fentanyl or I'm not using this. But there is help for all of you.
Yeah, it's a great point.
Yeah. It is super scary out there. And the thing that we said at the top, and just a reminder, it is a disease. And what I want everybody to know is that you are not alone. You've got these 2 people right now who are on this Facebook live stream who are there ready and willing to help you or anyone struggling. So if it's not you and you know someone who is, this is a chance to pass on this information. The Facebook will be up again. You'll be able to stream it and look at it and get all of the important information that you need. I want to thank both of you, not only for joining us here today, but carrying on as I lost my signal because I was listening to you and the information was spot on. So very important. Once again, we want you all to know that you are not alone in this fight. Pinnacle Peak Recovery is there for you. 888-AZ-REHAB. Thank you to both of you. Well,
Thank
make
you
it a
for
great day,
having us.
everybody.
Thank you, Terry. Thank you.